The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Peyton's brain surgery. One week ago, 9-month-old Peyton was diagnosed with hydrocephalus, a buildup of excess fluid inside the brain, which can result in permanent brain damage. The pressure is causing Peyton's head to enlarge, and she is suffering from headaches.
What have you noticed about Peyton at home?
The sides of her head is getting larger and she's becoming more irritable.
Doctors must restore the normal flow of fluid before her condition becomes debilitating.
Is this Peyton's first MRI?
Yes, it is.
Today, Peyton will have an MRI to prepare her for brain surgery.
So that's the part of the body that we'll be scanning today, the brain. And because it's a fairly long study, it's about 45 minutes to an hour long.
Okay.
Peyton is required to stay still during that time, and that's the purpose of having to sedate Peyton for that test today, because she's too small to be able to stay still for that period of time.
Okay.
Right now,
I'm just going to have you go on the other side. I'm going to shut the lights off. That's okay. Oh, Mommy's here. I know. You guys will go this way and I'll go this way, and I'll see you in a bit. I'll take good care of her. What's the she weigh?
10.7 kilograms. Scans completed and everything went well. I had to give her some more sleepy medicine because she just got up just a little bit, but then she went back off to sleep. And if she continues to be awake, we can send her back up to the floor.
Here we go.
Baby. Here you go.
There we go.
Morning.
Good morning.
Peyton has hydrocephalus, and that's an enlargement of the fluid-containing spaces of her brain. And her brain is under a little bit of increased pressure. And we're concerned that if this isn't treated, that she's going to not meet her full intellectual development. And the head will continue to grow to the point where it'd be noticeable to just about anybody that it was too big. So her x-rays suggest that she has a block right in the center of her brain where the fluid comes down a very narrow passageway. And we think that that's something that likely happened shortly after birth, but we're still waiting for the final MRI results to know exactly why that's there. But
So you don't think she was born with it? Or?
we may not be able to tell.
Okay.
She's one of the few children who we think could be treated without a shunt, which is a drainage tube that goes inside the head, underneath the skin and down to the tummy, but rather by going right inside her brain with a scope and making a very small opening in the floor of her brain and bypassing that block and allowing the fluid to circulate. It's a little bit more difficult than putting in a shunt, and it has to be done very carefully because there are some very important structures at the bottom of the brain right where we make this little opening. And we have to go into the operation with the idea that we'll have a look at the floor of her brain and make sure that it's an ideal surgical situation before we proceed.
Okay.
Because we don't want anything to happen to her.
Where's Peyton? Where is she?
Okay, hi. So do you have any questions at all, Dad? I didn't really have a chance to talk to you.
No, not really. Audrey's really kept me up to date, and it's okay.
So we're going to make a little incision right there,
Okay.
and then that should be all right?
All right.
The rest to be done with the scope.
Will the shape of her head subside a little bit? As
A
she
little
gets
bit,
older?
but her head is always going to be a little bit relatively large.
So you said that it will be 6 weeks before we know if this works.
Yeah, it'll be done in stages. First of all, we'll just see how the operation goes today, and then we'll just see how she responds over the next couple of days.
All right.
Great, thanks.
Thanks.
Smile.
Soon it'll be all over with. All done. Right?
All right, Peyton. I'm from anesthesia, and we'll monitor everything, in terms of gas exchange, heart and lungs, and temperature and breathing, and all of those things that are important.
Will she be in a lot of pain after?
I don't
Like-
think so. No, not
It's not a
typically.
big-
This is not but we will treat it. We'll have something to treat her,
Yeah, but
and
it's
she'll
not
be in
a-
a monitored setting, so that it'll allow us some freedom in terms of the amount of drug we can give, and we will keep her there until we're happy that she's breathing and awake and alert, and hopefully not encounter any other complications.
Okay.
Okay.
So I'm going to take Peyton.
Okay.
Okay, I'll just take her in my arms rather than lay her on the bed.
Okay.
I'll try to keep her asleep. Okay. Okay. Yep, that's great. There we go. Okay. All right. Can you give her a kiss? Okay, sweetie. It's okay. All right, we're going to go then, okay?
Okay, so this is the sagittal MRI, and these are the ventricles here, which are very dilated. We can't see on any images exactly why this has happened, but that's why she has the hydrocephalus. So what we're going to do is just make a tiny little opening right here, and that'll bypass this block, and then the fluid should start to circulate normally over the surface of her brain. And we can see this very critical structure here, which is the basilar artery. We have to be extraordinarily careful with that vessel. We can't injure that at all. So her soft spot is still open. So we're just going to go through the outside edge of that. And so we don't really have to drill any holes in her head either. So I've got her lined up nice and straight like this. So that helps us keep oriented from front to back, left to right. Yeah, I wouldn't go any more medial than that. That's good. Scope is fairly big, so we need to have enough of an opening that we can get it in. So we can tell her pressure's high because already her brain is starting to bulge a little bit.
Might be better just to walk around and not think about it. 2 hours, it would seem like 2 days.
Okay, so we've tested the equipment, we're all set to go. And now we're going in with a scope sheath, and we're going to go through a very small part of her brain, and we're just going to be basically pushing the brain fibers apart. In fact, you're going to drive. So straight trajectory down the scope, eh? Absolutely straight. Don't force it, nice and easy. Don't force it. There you go. Okay, so now we're all on camera. There we go. Okay, now we're inside the brain. Okay, so we're over too far on the right side. So there we go there. So now we're going to go down to the foramen of Monroe, which is that round area there, and that's our first target. And her block is probably just about there. We're not even going to look at it because it might start some bleeding, but it'll be just about there. And there's the basilar artery beating in the base of the brain, and that's the very important artery we have to stay away from. And we go a little bit farther forward. My goodness. This could be a challenge because it's so, you know what, the floor is so already so thinned out that I'm afraid of going down where we normally go because I'm too close to the artery. Okay, I'm not even going to go down that way. I think it's too dangerous to go down there. Here's the top of the basilar. Just asking for trouble. Normally what we do, we go down there, but I'm not happy doing that today, so I'm going to do something a little bit different. I'm actually going to try and make an opening there. So there's my forceps. So I'm lifting up the floor of her third ventricle there gently. It's starting to beat a little bit, you see that? So that's a good sign. There we go. There, that's better. Okay. Oh, that's excellent like that, actually. Look at that. So, yeah, see how it's starting to well up? That means that we've got a nice opening to start with. So our intracranial pressure now is quite normal. And we've got a nice opening in the floor. We just spend a little bit extra time making sure that the opening can't close over again. Okay, come on out. Lights on, please. A needle piece of gel foam. I'm just going to close the skin. We're done. One more coil. So that's it. We're done. So everything went fine, and she's a little bit more difficult than usual because this has been there long enough that just for anatomical reasons, the floor of our third ventricle was almost like a cylinder instead of a floor. Mm-hmm. And we had to make the opening just a little bit farther forward than we often do, but just to make absolutely sure we stayed away from that very important basilar artery at the bottom.
Okay.
So it just took a little bit longer. And then...
Will that affect the outcome at all?
I don't think so, because we persisted, and the floor of the third ventricle was like this, sheet waving in the wind once we had it decompressed.
Once the pressure was released.
Yeah, and so we spent a little bit more time and just shrank it down a little bit and opened a little bit wider, and ultimately we had quite a nice opening. But we'll just watch it very carefully and just see how things are going.
Okay.
Okay?
Mm-hmm.
Thank you very much.
Thank
okay,
you.
You're welcome.
Said she was sleeping.
She is?
Oh, look at her.
Just got a little oxygen on her for a while, okay? She had a little pain medicine.
Do you think she's in much pain or?
She was crying, you know, she was waking up and crying, so the anesthetist decided to give her something for pain.
Great.
She may have some discomfort. She may have a little nausea.
So she'll probably be here for an hour?
Here for an hour. Yeah, she came in here at 11:30, so 12:30 if all is well and she's awake and not complaining, she'll go upstairs to her room.
Hi, good morning. How's Peyton today?
She's better.
I'm Dr. Ratka, and I'm Dr. Drake's partner. So I'm just stopping in to see how she's recovering from her surgery. Can you just have a quick feel at the top of the head here? Okay, sweet. I gather there was a little problem after the operation with what sounds like seizures, right? What I think we'll do is watch you in hospital for another day or so. An EEG will be done today to be sure that there's no active seizuring going on.
Is it time for her medicine?
So neurology came by while you were gone.
Okay.
And they said it's all negative. The EEG was negative.
Oh, good.
So that's good. So tomorrow, their plan is to keep the Dilantin for today.
Okay.
And then he's going to talk to the big cheese guy, the big neurologist, and then they'll probably start to wean it off tomorrow.
Oh, excellent.
So that's good, Peyton.
That means we get to go home even sooner.
Yep. So probably today's Wednesday, maybe by Friday. Everything's okay.
All right.
Hopefully.
Her eye looks better.
That's because you're riding up in your stroller. Yeah. I think you're tired.
Yes, she is.
Like this guy?
I see you looking at me. I see ya. I see
You want her up or down?
She considers sort of sideways. Sweetie? Hello.
That's the only thing she never cried for.
Should be used to that. Almost.
It's okay, we're going home.
It's pretty straightforward. Just special instructions. Observe incision site. They're dissolvable sutures, but just make sure that they are going, and well, you'll know if you see any redness. Follow up with Dr. Drake in 6 to 8 weeks.
Okay.
So this is just what you need to sign.
Perfect.
Take her home. And are you planning to sort of leave now?
Yeah.
Is that it? Okay.
That's all right.
Yeah.
Bye. Take care.
I think she knows we're heading home.
I hope. Does this look familiar, Peyton? Hey, does this all look familiar? Hi.
How are you guys?
Good, how are you?
Good. How's she doing?
She's doing good.
Hey, sweetheart. Very good. Okay. Do you want to pop her up here on that table and take a peek at her? Sure. Lift your sister with you, please.
Yeah.
Oh, let's sit you up. That's a girl. There's your sister. Yeah, that's a girl.
Is she always going to have a soft spot there?
No, that should eventually heal in.
It'd be a good thing we brought Casey for keeping her occupied.
Okay, and I'm going to want to look in her eyes. So, Dad, I want you to hold her kind of on your shoulder on this one first.
This way?
Yeah, just shift her over onto the shoulder a little bit. Aren't you a good girl? Oh, aren't you a good girl? Aren't you terrific? That's wonderful. Good for you. Excellent. Great. Look here, sweetheart. Okay, great. Her pressure in her head is much lower than it was before. So what's happening with her seizures? Is that?
Nothing.
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 And was she on anticonvulsants for a short period of time?
No,
Well, she was here, and then when we took, by the time we took her home, they had taken her off of it. So.
Okay, so let's go look at her MRI.
Okay.
This is before the operation, and this is the scan that she had at the end of October. And initially you'd think, well, there's not really that much difference, but in fact, I think there are some quite significant differences. And if you look at the fluid on the surface of her brain, here there's very little fluid in the surface of her brain. If you look here, you see all the white fluid?
Oh, yeah.
So the fluid is circulating how it should be. It's coming out here and it's getting over the surface of her brain. There's no question that the operation has done what it's supposed to in terms of restoring the normal pathways, and I think it looks significantly better. So I think we should just continue to follow her along, make sure she continues to develop and is making good progress, and maybe get another MRI in another 6 months or so, and just see what that looks like. But I think so far so good.
And her behavior's better too. She's happier and
Got the personality that we expect. Okay. Thanks for the excellent care.
thanks for everything. Bye. Take care.
2 months after her brain surgery, Peyton has fully recovered. Now that the pressure inside her brain has been relieved, Peyton is no longer suffering from painful headaches. She will return to hospital for checkups, but doctors are optimistic that damage to her brain has been minimized and that Peyton will continue to do well. On the next episode of Life's Little Miracles, Jamie's palate surgery and Daniel's club feet repair.